Well, as I described earlier, you will have the team. There will be quite a lot of people in the theatre, so your partner we will have met when you first come into theatre in the cubicle, but we will not be bringing the partner back in until we are fully ready for surgery to begin, which is at the point of when you've been cleaned and you've been draped and everybody is in their place, because we have to be very aware of infection control reasons, and also the movement of the sterile field around the table. It's really important that everybody is actually in place before we have more movement, so that's the reason why we bring the partner in at that stage. Majority of ladies will have spinal anesthesia. I would say about 98% of our ladies have spinal anesthesia, but there are reasons why you may need a different type of anesthesia, and that can be for several reasons, which may be previous back surgery, a reason why you can't have spinal surgery, or you've had a bad experience and you really do not want to be awake. The ultimate aim is to keep you awake, because we want you to experience, you know, the whole thing of the birth of the baby and being with the baby and skin to skin. But there are occasions where it may not be feasible to do that, and you may have to have a general anaesthetic. In those kind of situations, we will get you back to your baby as soon as we can in the recovery room, and make sure that as soon as you wake up and as soon as it's safe to bring your baby back to you, we will do that. The recovery room again can vary. Going straight forward with no complications and all going well, we would hope to keep you in there for about maybe half an hour, 20 minutes to half an hour, if that would be the best scenario. Sometimes things can happen if the baby needs more feeding, or baby needs to be heated up a little bit, they're a little bit cold after delivery, or from the mum's point of view, if the blood pressure has if the blood pressure is a little bit high, or there's some medical problem lying behind, that we need to keep you a little bit longer and sort out your medication. Pain relief, if you have had a general anaesthetic, you tend to be a little bit more sore, so that we will try and get on top of the pain relief as soon as we can, because ultimately we want you to go back to the ward being very comfortable. We don't want you going back in any discomfort, because the more comfortable you are, the easier it is to nurse your baby, and that's really what we need to happen. Yes, you can hold your baby in theatre. It will be at the point where the baby will have been taken after delivery up to the Ohio, the baby heater. They'll wipe the baby down and they'll wrap the baby up, and they'll have checked the baby's temperature to make sure that everything's okay. At that point, the midwife will bring the baby over to you on the table, and she will slip your arm out of your gown just on the right side, just very discreetly popping the baby underneath your gown, so that you can have a really good cuddle and skin to skin with the baby. Well, as I mentioned earlier, we have some fantastic midwives in our department, and they are superb at giving great comfort to the mother, in that they will reassure you of the initial steps of breastfeeding. Some ladies will have never breastfed before, and they will take them through each and every step, and they'll be with you all the time in recovery. They'll make sure that the baby is latching on and feeding. Some babies aren't interested, and they can be the sleepy ones that aren't. They just don't want to feed. But the midwives will come back again after a little while. They don't want to tire the baby out at the same time, so they'll let the baby have a little rest, and they'll come back again. But the midwives will be there, and the care assistants as well. They are all trained in breastfeeding, and they give great help to the mums in recovery. If for some reason the midwife has left and they need to be called back at any stage, they will call them back as well. And then when you get back to the ward, obviously the midwives on the ward will be your first point of call. The ones we use in the rotunda, we have a gentle caesarean section drape, and this doesn't suit everybody, because it's like it's like a plastic window, and for those couples that would like to experience and see the baby as the baby's being lifted out, we can pull down a little drape. It's not open all the time, but at the right moment, when the baby's delivered, you can be helped to sit up a little bit, and you can look through this plastic window, and you can see your baby being lifted out. And that at the moment is as far as we go with gentle caesarean section. There is no cutting of the cord, unfortunately, because of trying to adhere to strict sterility. It would be, we feel, a risk to your baby from an infection control point of view. So you will not be allowed to cut the cord, but certainly to view the birth of your baby, we would do everything to help you with that. When you have a C-section, if you have a spinal anaesthetic or you're awake for the procedure, we would certainly encourage skin to skin with the mother directly after delivery, when the baby has been checked on the baby heater. For those mothers who have had general anaesthetic where it's not possible, we will include or bring the fathers or the partners into the equation. So once the partner is brought out of the operating theatre, we would encourage them and ask them would they like to do skin to skin. They don't have to. Some fathers they don't want to, but other fathers love it, love the idea. And we will put the baby, we will ask them to remove their top, and we will put the baby up on their chest, and then they will cover them all with a blanket. So it's totally up to the father or the partner what they would like, and they are more than welcome to cuddle the baby away until the mum is awake in recovery again, and then we will bring the baby back into recovery and continue with the mum doing skin to skin in the recovery room.